Good afternoon, I'm Dr. Gerencer, and this afternoon I thought I would talk to everyone a little bit about endoscopic sinus surgery. So first of all, what is that? Well, it's basically surgery that is performed with an endoscope. And for those of you who are not familiar with that device, that is basically this tool here that your surgeon uses to visualize the inside of your nasal passages. And the goal of sinus surgery clearly is to create a situation where you have fewer sinus infections that last shorter periods of time. So there are three broad categories of patients who might be counseled by their surgeon to consider endoscopic sinus surgery. The first most common category are patients who have what we call chronic sinusitis, and that consists of symptoms beyond a 12-week period in general that have only partially responded to previous attempts with antibiotics and other conservative medical measures. The second category are patients who have recurrent acute rhinosinusitis, and those are patients who seem to get sick every month or two and have to go on a course of antibiotics. Now, in those patients who have an established anatomic abnormality or the same sinus that seems to get infected, those patients can sometimes also benefit from limited or targeted endoscopic sinus surgery. And thirdly, the final category are those patients who have immunocompromised situations, who are, for example, receiving chemotherapy or other immunosuppressive medications, and they are developing complications of just a bad sinus infection, where it's, for example, spreading into the eye or spreading into the coating around the brain. Now, those are unusual situations, but those are situations that are taken quite seriously because they require surgical intervention on a somewhat urgent basis. So, in terms of endoscopic sinus surgery, the important point to keep in mind is that not all sinus surgery is the same. And it can vary from a very limited targeted balloon intervention where the surgeon slides a catheter with a balloon attached to it in the office setting to dilate a few key passages inside your nose, to a full-fledged traditional endoscopic sinus surgical procedure, which is done in the hospital setting under a general anesthetic that typically takes between 1 to 2 hours and typically requires about a 5-day recovery time. So in terms of endoscopic sinus surgery, the goal of what the surgeon is trying to accomplish basically is better ventilation and drainage to your sinus cavities. And it's important to understand that this type of procedure has a fairly intense postoperative healing phase. In other words, there are a number of things the patient has to be willing to do in order to ensure an optimal outcome. And in our practice, we tend to follow patients very carefully. It requires removal of any scar tissue, it requires addressing any areas of concern before they turn into areas where the sinuses potentially become re-obstructed and the patient then continues to experience further sinus infections. I'll talk a little bit more about that in just a few moments. So in terms of endoscopic sinus surgery, it's important to understand that if you're being advised to have the procedure done and it's a balloon procedure, that you understand the limitations in that advice. Balloon technologies are great with very speedy recoveries, and they can be helpful for targeted areas of narrowing inside your sinus cavities, but they are certainly not meant to cover more comprehensive situations where, for example, it's your immune system that's causing a general diffuse problem inside your sinus cavities that would need to be addressed through more formal endoscopic sinus surgical approaches. So again, the key to understand with endoscopic sinus surgery is that no two procedures are identical. There's a lot of variability in the nature and the extent of the surgery that's going to be discussed with the patient, and you really need to set realistic expectations and know those in advance and discuss those with your surgeon so that you can understand what the goals are in your particular situation. So that then leads me now to discuss, actually put that there, because I forgot where we're going to do the revisions.